Hello, my name is Cecilia Wilson. Thank you for joining me in this presentation titled Early Childhood Mental Health, the Importance of Timely Analyzation and Facilitation of Support Services. If a child is diagnosed with diabetes, hospitalization may occur, as well as treatment, an action plan for the school and home, and continual follow-ups to ensure that the child is maintaining their health. When a child is diagnosed with asthma, again, hospitalization may occur, treatment is received, an action plan for both the school and home is compiled, and continual follow-ups are ensured that the child is maintaining their health. From the Child Mind Institute of 2015, mental health illness is a common childhood illness affecting an estimated 17.1 million children. And yet, less than 5% of our schools promote and or participate in mental health screening as detailed by the NEST 2012. Mental illness is a hidden disease that is not easily seen as that of a person in a wheelchair. Could this precipitate a stigma? Lack of knowledge robs those with a mental illness that is assumed with most others. Examples would be a good job, safe housing, and positive connections with others, as highlighted by Corrigan and Watson. Sadly, there is self-stigma as well, creating a delay in requesting help and causing a severity in problems. Others may view it as, well, it's their own problem to work through, and this unfortunately leads to negative thought patterns based on self-worth. Statistics from the Centers for Disease Control, the CDC, from 2018 highlight 1 in 6 children between the ages of 2 and 8 have a diagnosis of mental, a behavior, or developmental disorder. In a typical classroom, this translates to 4 children per group of students exhibiting mental health illness. Additional statistics from the CDC highlight attention deficit hyperactive disorder, or ADHD, as ages from 3 through 17 diagnosed at 9.4%. Behavioral problems in the same age group, 7.4%. Anxiety disorders, 7.1%, and diagnosed depression, 3.2%. A negative, lasting impact of early mental health problems may persist for a child even if their overall mental health improves. Thus, as Kuehler in 2015 highlights, we should be strongly motivated to prevent, identify, and treat mental health issues as soon as possible. From Torrio and Associates of 2015, evidence was found that between 2006 and 2011, emergency room visits increased by almost 50% for those in the age group of 10 through 14. 30% were due to substance abuse and 70% due to impulse control disorders. Mentally ill children and their struggle translate to within their everyday life. For most, this will include the one place that children spend a significant amount of time, school. Frotzenhoff and Associates in 2017 research concludes that those who spend a significant amount of time with children are the best to analyze and intervene for mental health. Mental health and educational outcome are connected. There are additional alarming statistics. 1 in 5 youth between 13 and 18 years of age will experience a severe mental disorder. 70% of youth who are currently in the juvenile system have at least one mental health issue, and of that group, 20% have a severe mental illness. Those are described as schizophrenia, bipolar, or major depression. This information is highlighted from the National Alliance of Mental Illness of 2019. Research by Allison Kuehler in 2015 discovered that there are policies and programs available for children, but unfortunately, coordination is fragmented. Kuehler states, too, that most programs tend to treat the problem currently, yet do not institute changes for a long-term effect. Her hypothesis is that with some children treating less for relieving symptoms and more on educational achievement and overall functioning may produce greater long-term results. Certified staff, unfortunately, feel slightly more confident than those in the classified staff in recognizing children with mental health distress. Thus, training and utilizing all resources are most effective when the whole school is involved, as Frensenhoff, Mendenhall, and Moon in 2017 illustrated. Thus, so far, we can say prevention rather than treatment. Prevent mental health problems before they occur, or minimize or correct the course of the problem once it manifests. From the Child Mind Institute, our nation must make a commitment to better training, robust research initiatives, and expanded public education efforts. Early Childhood Mental Health Consultation, or ECMHC, is an early intervention of aid to those who work with young children and educates those caregivers with knowledge, encouragement, competence, and confidence. This aids in early intervention, which long-term helps those with mental illness. As well, teachers can be taught specific skills to increase their awareness of a student's needs, help them cope with the student's problem behaviors, and encourage cooperation and communication more effectively with all students. Continual interventions. By Felitti, Anda, Williamson, Spitz, and Edwards, found that analyzation tools to measure the significance of negative or positive life events on a young child helps determine adverse childhood experiences. This information enables those helping the child to determine the extent of the help or assistance that is needed. Additional research as well from the ACE, or Adverse Childhood Experiences, has found to positively react to CBT therapy. CBT, or Cognitive Behavioral Therapy, developed by Beck, is a process that teaches those experiencing mental health difficulties to frame the restrictions that their feelings on their thoughts into a specific control of emotion regulation and self-awareness. This is a questioning of one's thoughts instead of the assumption that negative thoughts are true. Abuse or mental health dysfunction occurs on a basic biological level of the body with the limbic system. This system regulates anxiety and mood, and when affected, is unable to regulate on a consistent level. Mental illness is a medical condition that disrupts all of what makes a person. The frequent encounters that educators have with children allow a unique opportunity to identify and access interventions for the child. The first connection of caring will start the building blocks of a healthy mental frame of mind. References, page 1. References continued, page 2.